Kayla, once again with your lateral, what I prefer to use the word epicondylology. That tells me you have pain on the outside part of your elbow. There is a means to do it at home, okay? So let's demonstrate that to you, and you can sort of make up your mind if you want to come in on it, 3 times a weekly basis and do it by machine or do it at home. Okay. All right. So I'm going to clean the area again. Now this time the ground's going to be down here. It's very difficult to sit up here and here with this type of pad. So the ground's going to be down here. Okay. So class, this is a 1 millimeter fill or CC, whichever you prefer. This is going to give 80 milliamp minutes. Okay, so a stronger dose, but it's going to actually be on for a longer set of time. Okay, and I need to actually read and see if it says time on it. Patch wear time, 6 hours. Okay.
Okay.
So we'll look at the clock when we get it set up, and when you leave after 6 hours, guess what? Take it off.
Okay.
Okay. That's simple. So guys, I do need to show you. Cookbook is right here. It will basically tell you everything you need to know as far as how to put it on and everything like that. Okay. And I will say this: the majority of times, this is the way it's done. Okay, so we're going to look at our pads here. So the battery's right in here, and when the fluid of those two come together, voila, the battery's activated, and that's how it's driven. So dexamethasone, once again, is a negative polarity, so medication's going down here, and we use saline to activate this side. Okay. Alrighty. Good. Yep. All right. Let's see. With these electrodes comes little saline vials, and I don't know if the odds are, I can't even see them. Let me go this way. So we're going to do 1 millimeter. It's not very much. This has actually 3 millimeters of saline in it, so we don't use the entire amount. Talking about making a mess and the pad not sticking. Okay, we'll just twist it off. Alrighty. Double check this. Yeah, right here. It's even got positive and negative. This is almost dummy proof, isn't it? All right. So they say start in the middle. Get in there. Bubble didn't want to go in. A little bit more. Basically what I'm doing, I'm just looking at the areas where if it's not hydrated, just sort of feeling it.
Does it all have to be like soaked or like wet?
It needs to be. It'd be more comfortable for you. We
Okay.
did a pretty good job here. Okay. So this is the dexamethasone. This is the medication. And it's 1 millimeter or CC. However you like to say it, guys. Okay. All right. Once again, we'll just hydrate this guy here. Sort of coming together, ain't it?
Mm-hmm.
Yay. That's a good thing. And I'm out. There we go. All right. Use that scoop technique again. Voila. All right. Believe it or not, the battery's already running. Yep. Peel these guys off. And I need to remember, we got our deals on the side here. Negative, remember, if we put the positive down there, guys, we did nothing. We're going to treat down here. I want to have you straighten your elbow slightly so that you're sort of comfortable. Alrighty, so we're going to come in. It's basically that simple. Okay, so remember us talking? How long are you going to wear this?
For 6 hours.
6 hours, yeah. Alrighty. Kayla, I think the odds of you feeling anything are zero. Zero, man, to be honest with you. All right, so it looks like that's a good application. It should stay. You can go about your business today. You can go work or do whatever you need to do, okay? You do want to keep it clean. Okay, here's some don'ts, guys. Let me talk to you about this in case I forget to cover it later. But you need to cover it with your patient. You don't want to wrap something over this, like a Coban or Ace wrap. Too much compression may cause skin irritation, okay? So be aware of that. That's a big no-no, okay? Don't get it dirty. Don't go out and something like that and get it filthy, or bear crawl, or all four crawl, whatever. Now, also, I need to tell you, I'm gonna be honest with you. If you go work out or work hard, you start to perspire, okay? Because I know women don't sweat. But if you start to perspire, the adhesive will start to come off, okay? And you'll lose contact and stuff, okay?
Okay.
Alrighty. And you please inspect your skin, because if you come back in, or if you decide to start doing this home, we'll give you the pads and go from there. But I have to know. If you
Okay.
start to get skin irritation, we need to talk. I need to get you back in here, okay?
Okay.
Alrighty. Well, thank you for your time.
Thank you so
Alrighty.
much.